So I'm with Janine McCready, who is one of the co-recipients of the 2020 Savita Shah Award. So first of all, Janine, congratulations. And I just wanted to ask you maybe if you could start by telling us a little bit about yourself, and then we'll talk a little bit about the work that you've been doing.
Sure. Well, first of all, thank you very much. I'm really, truly honored to receive this award. And so, a little bit about me. I mean, I grew up in Edmonton, Alberta, born and raised there, and a true, still a Oilers fan, despite the ups and
Yay!
downs. Yeah, and then moved out to Toronto for medical school and completed my medical school and then residency in internal medicine and then in infectious diseases here in Toronto. And since I graduated, I've been working in a hospital in East Toronto as mainly kind of within the walls of the hospital for most of my work, although we did some community outreach because infectious diseases kind of lends itself to a lot of different, community issues. So, spending a lot of time there. And then I have two wonderful kids that are super cute and fun. They're 5 and 8, getting really big. So, me and my husband both, he was from Edmonton as well. And so he moved out here at the same time for law school, actually. And yeah, so we're super lucky, have two healthy, happy kids. And yeah, mainly working at the hospital and doing everything kind of COVID wise the last 2 years. It's kind of been all consuming. But yeah, that's a little bit about me.
Well, I mean, yes, it's been all consuming, and I think we've heard reports on TV, all of us, and through the news and all that. But you somehow also found the time, while also being a mother and a partner, to do this other project where you were reaching out to children. So, can you talk a little bit about that work and how did you get into that?
Yeah, for sure. I mean, I think at the beginning of the pandemic, schools were mostly shut down, during the first year. And then when schools started to reopen in August and September of 2020, we were oftentimes calling all the families that would get COVID in our area. So, a family member would test positive, we would call them, have a conversation with them. And a lot of the time it was parents that were working from home, they weren't going anywhere, but their kids were attending school. And so the only real source of where they could have gotten COVID was through their children. But at that time, the messaging kind of at the beginning of the pandemic was first it was kids don't get COVID, and then, well, kids don't really get sick from it. And there wasn't really any like easy testing options for kids. And in the schools, it was, people didn't really know what to do. So from having these conversations, we really realized like clearly the kids are getting it from, and likely from school or from other interactions. And we need to do something to make schools as safe as possible, and also to then also, protect their loved ones and keep them healthy too. So that's kind of where it started. It was really just like, as we were talking to families, realizing, okay, no, like this is something that needs to be paid attention to. So, I mean, basically in August reached out to all the schools in East Toronto and kind of started with our schools that were in higher priority areas. So schools with like a lot of density, a lot of new Canadians, and, multi-generational homes. So families that had kids up to grandparents, with living in a 1 or 2 bedroom apartment, where we knew or we thought the impacts were of the pandemic, and when kids were going to back to school would be higher, on their health, and also on with the limiting, like not having paid sick leave, is going to have a huge impact on families if kids got COVID and brought it home. So we started with those kind of priority schools, and the principals at those schools they are amazing human beings. So they were kind of like so happy to have someone to just ask their questions, because they'd received a lot of guidance from the boards and from the ministry, but then how do you distill that down to the local level, right? Like one school we have, it's the biggest school the biggest elementary school in Canada. There's about 1,500 kids that normally go to school between grade 1 and grade 5. And so, at people in the morning when the bell rings or at dismissal, there's literally like 3,000 people that come down from, buildings around the area and are all in elevators at the same time, all coming to the field at the same time. So how do you,
right,
deal with that, right? So started with that, and then I mean I could go on forever, but that's kind of where it started. With those relationships with the schools, and then from there we kind of just as we went responded to their needs, and really realized that it was kind of, there was official things set up like public health to deal with it, but they didn't have the same kind of connection to the community. And so, me and my colleagues seeing family members of those kids being admitted to hospital and sometimes passing away, I was like, you were driven in a different way to be able to do everything we could to try and keep those kids in school healthy and then prevent the transmission back to their families.
Wow. And so when you say that there were that this was the starting point, so where did it go from there, and who else was involved? Like, was it just the schools and the hospital, or did you have people from public health, people from the school district? Like, who else kind of was part of this project?
Yeah, so I mean, I think as things evolved, we kind of built on the relationships and tried to involve all of the the key stakeholders in the community. So I mean, to begin with, it really was really grassroots. It was like the first call we had was me and kind of a few principals from one priority area, and then we expanded it to other areas that had similar issues, and then we expanded it to all our schools. Invited and tried to form relationships with the trustees in the area and with the superintendents, and then things were all evolving. So most of the schools had kind of a public health liaison. So we tried to then form relationships with them. A lot of what, you could tell they were stretched and they were kind of at their limits, and they also didn't know the community. So we tried to work as much as we could with them kind of collaboratively. And one huge thing that we did, and we helped to kind of lead and then spread to the rest of the city in conjunction with our hospital, and then also other hospital partners with the hospital so Michael Guerin is where I work, and then also with the hospital for sick children and women's college. And so we expanded this testing program to the whole city. So, I mean, obviously a key component of controlling COVID is testing. And so, back then, most of the swabs were done by that deep, like kind of brain biopsy nasal swab, which is nobody likes that. So, we quickly realized like we need to get an easier method to test kids, because I had to do it to my kids a couple of times, and I was like, there's no way this is going to be a regular thing. So one of my colleagues who's brilliant, Dr. Kendall, he came up with basically devised and we validated a new way to swab them, which is now kind of the way that most people are recommending to swab, especially with the new variants. So doing kind of cheek, tongue, and then just the front of the nose. So it's easy. Kids could do it themselves. Something that you're not going to be afraid of, it's not going to be painful, and also could be self-collected. So if a kid takes I actually think I even have I have one here. Maybe not anymore. So we basically had little sample boxes that kids could take home. So here, I got one here. So like you get a little thing like this in your backpack, and kids could go home, you take it out, you swab yourself, and then you bring it back to school. So trying to make it easy for families, because I know what we were going through. So it was not easy. It was definitely not easy, but it was, we knew what was important to figure out. So we helped roll that out. So the schools had this accessible testing right there. So if, my kid shows up with a cough and a runny nose, the principal or the teacher can just hand them one of these. They go do the test, drop it off at the outreach center that we conveniently located near these schools. And then you'll have an answer in 24 hours, So and then we helped to roll that out with the partners to the rest of the city. So it was definitely a group effort, but it was also interesting because there was lots of opposition from, the different layers of public health and the school board. And, in the end, we were all got on the same page, but, anything new that required like kind of more effort, it was kind of outside of what people technically wanted to do. And even with the NPs, like they were like, no, you have to go to the center and do the NP swab. We're like, well, no, like, let's make it easier for families. So, so we, in the end, it did become very collaborative between the group, and we shared a lot of learnings and everything, but it certainly, there was a very challenging period in the fall where we kind of built everything.
Yeah. Wow. Now, did I understand correctly, or maybe I got this wrong, but did you also speak with the kids through this project?
Yeah, so we did. So we did a few regular things. So basically, to begin with, it was like basically every week or every 2 weeks that we
Mhm.
did calls with the principals, and then we would do kind of alternating with just the principals, and then with the principals and the school staff and the teachers, people in the office, so that they were equipped to answer their questions and also knew what they were dealing with. And then as things in about November and December of 2020, we'd started to do a lot of testing actually in the schools during class. So in the areas where there was like significant levels of community transmission, we actually went into the schools and kind of went class to class. So we'd hand out these swabs. And then while we were there, we'd also talk to them about, like, this is the importance of it. This is how you protect yourself. This is how you protect your family. This is how we keep everyone in our community safe. So we kind of joined the testing and then a little bit of public health stuff together. And then so we did that. And then once vaccines were available, so later, kind of
Mhm.
for adults, but then more for kids. So when the 12 plus, 12 to 17-year-old vaccines were available around May of 2021, we did again a number. It was mostly me and then local community partners. So someone from the community that was, that understood either different languages and different cultural issues. We were doing a number of forums for the parents, and then also did some with the schools during school for the kids so that they could actually ask their questions too. So we did those for the teens, and then this fall, now I'm trying to remember all the timelines. Yeah, so then this fall, it was kind of more like November 2021, then we did more forums for parents in the areas. And then some kids would join too about vaccines for the 5 to 11-year-old cohort so that parents could ask their questions, straight to somebody that I have kids that are in that age group, but I also have read every possible thing I can about the COVID
Yeah.
vaccines.
Wow. Was there, I'm always interested in what kids think about and how they process the world. And I think I mentioned that I was I'm an educator as well. I just recently retired from the university where I taught teachers basically. So I may have taught some of those teachers that you were working with, but really interested to know if there was anything that sort of sticks out in your mind about things that particularly the children asked about.
It's a good question. I mean, I think the main thing with the kids is that, I mean, to them, they just wanted, they just wanted to just do things, right? Like to them, things weren't a big deal, right? Like you go into the school, like to get permission to go into the schools and do the testing was huge. Like, it was a giant ordeal. And the part of the idea from it came from actually talking to parents on the phone. So we would call people that had COVID and we'd say, well, what would make it easier for you, and they said, if you just tested the kids at the school, like I would feel it was safer. It would be easier for me. I don't have to take a day off, and so that's where the idea came from. But it was like a lot to get permission to do it. But with the kids, when we started doing it, they were just, most of the time with anything, they're like, this isn't a big deal. They're like, well, let's just get on with it. So for the testing or for the masking or for anything like that, the kids are kind of like the most easygoing about all of this. And I think we really haven't prioritized kids as much as we should have throughout this pandemic. They've really taken the brunt of a lot of the the things that have happened in society over the last 2 years. So I think knowing from them, they're so resilient. But if you just make things easier for them in little ways or make things clearer, they're so appreciative. And most of them, I'm trying to remember some examples, and some of them they were so cute. And so one of the best things at one of the elementary schools to try and get them, because you can't say, okay, stay 6 feet apart,
Right.
like that, everyone kept hearing that, but we would use zombie arms. So when they were like standing in line in hallways and things like that, then you get them all to like put out their zombie arms. And if you see them all crunched together, like, where's the zombie arms? And so they'd put their arms back out and then they'd space themselves out again. So, simple things like that don't have to sound like official and public healthy, but are just like helping them to keep each other safe.
Right. Oh, that's fantastic. So, one last question about this, and then I'm going to ask you a little bit about SUNY, but just lessons learned. What have you learned from this that you think all of us ought to know?
Yeah, that's a big question. I mean, I think I mean, don't give up. I think that's one thing. If there's something that you think is important, that you can make a difference, or that needs to have someone care about, then don't give up. I mean, there were so many times, especially in our first few months, where I was told, this is not your role, this is not your job. Like, we've got this covered. And clearly it wasn't, because I kept getting calls at like 7 a.m. and 10 p.m. from principals, like not knowing what to do. But if, not in a, I was probably stepping on people's toes, but in a way that it was like they needed it. Right. So I think if you truly believe something is important, don't give up, even if it's hard. I think sometimes the harder something is, maybe the more important it is. I think, really, obviously we always say, involving a local community and understanding, but I think I've learned so much from the people in all these communities that we've worked with. Like, a lot of these places are 10 minutes from the hospital, but I haven't, besides being, a physician at the hospital, haven't spent time interacting with them and learning how people live and learning what their concerns are and why people, did or didn't want to go for testing, or did or didn't want to go get vaccines. It's always helpful to listen to people and to really hear their perspective, and then be willing to adjust. So I think that was huge, because there's lots of, I think, preconceived notions about how public health should be done. But hearing, like, when we, a lot of what led us was having those individual conversations with families and with people and with the principals and the teachers and the kids, right? And that, I think that's key. You always have to kind of being able to adapt that way. I think those are the two biggest things for me, I think. There's so many things. It's been a wild ride the last few years. Yeah, I think obviously probably good to also to make sure that you kind of loop back and are always reevaluating what you're doing, that it is still serving the purpose and helping to improve the situation for what you intended to be, and kind of reevaluating as you go, I think is really key too. Because what we were doing throughout changed, dramatically from August of when school first started up until even now. We kind of have really kind of adjusted to what's happening in the schools and with COVID and with everything.
That's fantastic. So let me switch gears just a little and just ask you, you've asked us to give the donation in your name that's part of the award to SUNYA. And as I was mentioning to you before, I know a little bit about the organization, but do you want to talk a little bit about it and maybe your connection to it?
Yeah, sure. So SUNYA stands for the Seminar on the United Nations and International Affairs. And it's basically a summer camp for like a United Nations International Affairs summer camp held in Goldeye, Alberta. So in the kind of the foothills, beautiful location. And every year there's a seminar for 2 weeks in late August, and basically targeted at high school students, I think grade 10, 11, and maybe even grade 12. Really, I went as a student many years ago now, and then I was a counselor for 4 years as well. It's really kind of an amazing place, to share ideas, to have discussions. I liked school in high school and participating in things, but it was a place where really, it kind of unlocks your view of different global issues and kind of able to have these conversations with like-minded people. And I think for a lot of kids at that stage, it really gives them a view of like, oh, these opportunities that they could integrate within their future when they're deciding, what to do for university and after high school. So I know it was a very important experience for me, and I was very lucky to be part of the program for a number of years as a counselor. And then after me, my sister came, and she was a counselor and actually the director of senior for several years as well. Yeah. So it's a really magical place. And so I just want to, I think giving the donation there allows maybe a student that wouldn't otherwise be able to go have that opportunity. Yeah.
That's fantastic. So before I turn off the recording, is there any message that you want to leave us with? We'll have this on our website, as I said. So any message you want to send out to the people who might look at the Gandhi Foundation website?
I just want to say thank you. I mean, I think, as I said at the beginning, I'm very honored to receive this award, and thank you for being nominated and considered for this. It's I everything that I've done for the last 2 years was really to try and improve things for other people in some way. And if anyone sees this and thinks, I want to try and do, like, they've been thinking about taking something on, take it on, try it, right? Like, the worst thing that can happen is that it doesn't work out. And I think there were many times throughout this journey that I thought, okay, like, is this really worth it? And I think it was overall. And it's, if you're making a difference for even a few people, it's worth it.
That's fantastic. So that's Janine McCready. Thank you so much.
Thank you.